Falls are among the most common adverse events reported in the hospitals according to Stagg, Minion, and Shore. It is estimated that over 1 million falls occur each year. Falls can lead to longer hospitalization stays, greater healthcare costs, and even death. The Center for Medicare and Medicaid Services states that the falls are one of the 8 never events that should occur while in an acute hospital, and the CMS will not reimburse the cost for any treatment or procedures that occur relating to the fall, costing the healthcare industry money. With a great number of falls each year, what is being done to prevent these falls? Does the nurse's knowledge or education need further reinforcement pertaining to how to assess a patient's risk of falling? Does the nursing staff using the fall scales that are currently being used in practice done properly? Preventing patient falls in an acute hospital setting still requires further research.
Link. Why change? Change is necessary in order to protect patients from falls that can cause physical and psychological damage. Physiological damage consists of brain strains, breaks, bruises, and harm to the patient that causes physical problems. Psychological damage consists of fear of mobility. Link. Current interventions, prevention strategies, education about fall prevention, fall risk assessment, Morse fall scale, Braden scale, Hendricks scale, underlying medical conditions such as dementia, conditions affecting balance and gait, conditions affecting physical, mental, and vision. Link. Proposed changes. In order to get fall prevention to take action, we need to reinforce fall prevention techniques upon staff members to help decrease fall risks. Safety concerns are more interventions to reduce the fall risk, such as bed alarms and rooms closer to the nurse's station. Link. Measurement indicators, individuals documenting falls, nursing staff documenting fall reports at hospitals or acute care facilities, scores based off of the Morse fall scale, patient reporting their own falls, and high fall risk assessments.
Hello everyone, now it's my turn to introduce the part of the fall prevention to you. I use the synthesis uses another study which is involving the concerns and exploration of users and caregivers' needs and expectation on fall prevention. For prevention brochure, this is a qualitative study, and the purpose of this study is to explore and compare nursing home residents, family members, and the nursing staff's needs and expectation regarding a fall prevention brochure. To findings. The residents want to be informed about dealing with extrinsic fall risks and coping strategies after a fall event. In addition, family members wanted to have detailed information on eccentric falls risk, as well as specific falls prevention strategies such as body exercise. Relevance. So not all the we all know not for all the falls is preventable, even though we do a lot of the preventative measurement. But the family member and the patients, they have a different expectation about the falls. So one brochure could not compromise all postulated criteria, and different brochures are necessary for residents and for their family members, because every patient's situation and their activity levels are different. Feasibility is not all falls preventable. We all know that. The information to be included in the brochure for family member overlapped partially between family member and nursing staff groups, but evidence practice showed physical activities and a positive attitude to achieve compliance in fall prevention is recommended in national and international guidelines. Benefit: the patients and family members get some acknowledge and skills to prevent the falls, to get the from the brochure. Risk: it's unclear whether a family member are really doing what they have been related, such as doing the physical activity with their residents, with their family members, keeping in mind the effect of social disability. A second researcher independently analyzed on focus group interview transcript and then compare the result needed. So we need another research.
The article that I chose was Development and Evaluation of a Community-Based Fall Prevention Program for Elderlies. The purpose of this article was to research the outcome of a fall plan that was taking place in a small community in Bangkok. Quality and quantitative data were collected via a 4-phase plan that included situation analysis of falls, program development, program implementation, and program evaluation. The findings: the fall assessment plan was successful. The study revealed that the use of a multifactorial approach was effective means for reducing elders in fall in the selected community. To prove that this fall prevention intervention was reduced falls in elderly, the relevance of this study was to find a fall plan for each elder individually based upon physical and psychological needs. Feasibility. When it comes to feasibility of the study, it takes much more time than just a scale that can be used in order to put a patient on a high fall risk precaution. This fall prevention plan takes much more time according to this method. This method not only tests the patient's risk, but it was based on 7 measurements. 1. The researcher development demographic data and fall history questionnaire. 2. The fall risk assessment plan. 3. The research development fall prevention behavior questionnaire. 4. 22-item environment hazard assessment questionnaire. 5. The 4-part physical performance test. 6. Partnership checklist. 7. The researcher development satisfaction with the fall prevention program questionnaire. The benefits of this study is to find the most appropriate fall plan in order to decrease the risk for falls. And the only risk that was involved in this study was an elder patient falling during the fall prevention trial or patients falling outside of the fall prevention plan.
A qualitative research done by Qing, Ying, Anderson, and Parkash had explored the nursing staff's awareness of keeping bed in the lowest position to prevent falls and fall injuries in an adult acute surgical inpatient care setting. The purpose for the study was to explore the nursing staff's awareness of the importance of keeping beds in the lowest position to prevent falls and fall injuries in an adult acute inpatient care settings. The sample size was RNs and PCAs that are over the age of 21 and can speak English. 18 RNs and 13 PCAs were interviewed. Traveled and contingent staff were excluded. Methods used: a semi-structured interview done on nursing staff of a 52-bed adult acute inpatient surgical unit in Michigan. The pilot project was approved by the review board of the hospital that the study was being conducted. An alpha prototype bed height sensor was developed to measure and record bed height. The low bed height is 24 inches from the top of the bed to the floor. The sensor would alarm the nursing staff on their computer screen if the sensor detected an increase of 2 inches in 2 consecutive readings, and would flash a yellow indicator on the screen at the nurse's station. If the bed remained in an elevated position for longer than 30 minutes, it would flash a red indicator on the screen. Data analysis was done by trained research assistants. The interview was then transcribed. 2 members of the research team assessed the transcripts independently using content analysis. Discrepancies in the themes between the 2 researchers were discussed until a consensus was reached. Limitations were of that, not being able to ask more staff and then the staff that has completed the interview about the extent of the nursing staff's awareness of the importance of keeping the bed in the lowest position due to nursing staff having heavy workloads and lack of time to participate in the interview. Conclusion was nursing staff are aware of the importance of keeping bed in the lowest position to prevent falls regarding bed falls. It adds, in addition to having the nursing staff aware of the importance of the height of the bed, that physician awareness of the need to keep the bed in the lowest position needs to be addressed also.
A quantitative research article that focuses on how primary care practices can make a difference in the outcome of falls for older adults. The dependent variable is to improve strategies targeted at preventing falls in older adults, while the independent variables used are a fall screening tool, interventions, and assessing older adults 65 years of age and older. A 25-month continuous quality improvement process engaged a team including family medicine residents, physicians, nursing staff, and patients beginning in March 2011. The purpose of this article is to take the studied information to evaluate if certain interventions that need to be placed based on the patient's previous encounters with falls have decreased the number of falls adults in the age bracket of 65 years old and older. The basis for this study to be done was to minimize the number of hospital visits a patient had to endure due to injuries from falls. The sample size is based on 2,021 individuals. The sampling method was based over a 12-month period from July 2011 to June 2012, using PQRS, which is also known as Physician Quality Reporting System, TUG testing, which assesses mobility and gait of the patient, along with a safety assessment such as orthostatic vital signs. The design utilized for this study was a time-dimensional design with retrospective design. Physicians gathered previous information from patient charts and recorded hospital stays to compare the data received during the current study to ensure that patient falls have decreased. The CQI team designed the intervention, which included a clinical protocol, a falls evaluation clinic, patient self-management resources, a falls registry, and an electronic health record template. The patients selected were those that were seen at least once over the duration of the study period who met the requirements of being 65 years of age and older. Analysis was completed using incidences of individuals' falls who have been exposed to the intervention put into place, those who have not, and those who did not have adequate exposure to the intervention put in place to prevent falls. The information was then compared to the incidence of hospital visits over the one-year period, including admissions, ER visits, and all visits with the percentage of individuals screened and assessed increasing. Unfortunately, even with implementing PQRS fall measures, the reduction of serious falls was not achieved. According to Landis and Galvin, this could have been due to the implementation not being fully carried through, as well as the management of the falls prevention program.